Right. Well, this is another. Right. Hi. So I'm Tony, and I've made quite a few of these little videos. And one I've always wanted to do is on endodontics. So here we go. I think I'll get into trouble with this, but what the hell? Endodontics. Ooh, reflection. I made a video on endo for the public, so you should find this on YouTube. So go Teeth for Life YouTube, type in root fillings, it'll bring this up. And so this is a longer explanation and possibly a slightly more in depth. So see what you think. It's slightly alternative, I think. And yeah, so I come across this recently when I was looking up root fillings. And so it's a really good site. It explains different things. And I think, oh, it's quite a lot of depth here. And who is it for? So as you can see, as with all these screenshots, if you want to have more detail, then just pause it as you would. So I used endomethasone, and this is about root fillings. And so this is in the days when you could use endomethasone. So I know I'll just give it a brief mention in a moment. But what's interesting about this website is that it mentions all about the root canal stuff there. So root canal therapy, which we'll talk about, root planing. I think generally we don't do that anymore, which is probably just as well. Rubber dam, and this is lots of people my age didn't really get on that well with rubber dam. And I say didn't get on well with it. Neither did the patients, and we kind of lost the reason why we did it. But this is the site that I got this all from. It's a site for solicitors, isn't it? So, and this is the main reason we don't do root fillings, is because people like this. Yeah, and I'm not going to put lots of little features on, but this is what they talk about. So you can pause this and read it. It's a bit depressing, but this is what they do. They do other things as well. But this is all about doing more root fillings. How can we do more root fillings? Because a half decent root filling will last a lot better than an implant. And that's the way things are going. And I don't think that's a good thing. You have to look at alternatives. So in the beginning, we use silver points. I use silver points. I use spiral fillers with just endomethasone. I use endomethasone. And we did hand filing. And yeah, so we had, I think it was called a parachute, and that's what we used. And the picture of the red arrows is that I haven't been able to find the reference, but back in the day, someone did either 12 or 20 RAF pilots or worked in the RAF. And they had endomethasone deliberately spun through the apex of the anterior teeth for a root filling. And they said they had 100% success rate. Now, I'm not 100% sure the rationale between not having it, I'm sure you are, because you're a lot younger than me. But sometimes we need to think why we use products and sometimes why we don't. Like for root fillings for children, we used formocresol, and I used that for a while. Then it got withdrawn, and it never got withdrawn. Oh, use this instead. It was use this, and well, from what I can see, take a chance. I use Ledimix. Don't think you're allowed to use that anymore. Anyway, what do I know? But what I do know is it was a pain in the arse trying to do root fillings with slippy fingers. And this time it helped a bit because we didn't wear gloves. When we started wearing gloves, it got a lot worse. I think we had biogel gloves. They were okay, but most latex gloves, God, they were really slippy. So, you think it's tricky doing a root filling now if you're going to, actually find the canal. We think of find the file. Anyway, so these are things that I have used. So that's the gyromatic. So that was the first time I started to relax. It was when that you could actually put the file into the handpiece and let the handpiece do the work, and you wouldn't drop it. You might break it, but it'll break in the tooth. So that was far better than the other consequence. And this, I had one of these, and I used it for a little while, and then I gave up on it. And then I lastly found out for good reason. But I did use it for cleaning out canals with a fine endosonic tip. So, I have had a go at doing root fillings. This system here, I remember being taught by a very good endodontist in Bristol. And he used the Lightspeed for a long time. I'm not sure if he still does or if he still works. But anyway, this was really good. It's like lots of series of gate Gliddens, and I'm not sure what you're taught if you ever taught the history of endo, but that was a really good system. I'm sure there are other systems out there. And now, in the end, I just used profiles and pro tapers, I think. And yeah, when I was using Lightspeed, then I also used Thermofill, and that was very good for, System B was the main one, but Thermofill seemed to work quite well because I see for some of them, I think it had silver points that carried the hot GP down the canal in theory. And I had some fantastic results with this on the radiograph. Unfortunately, I got a few patients who just unfortunately kept saying that they hurt. They hurt to such an extent that they had to take the tooth out. And these were my perfect, little puff of calcium hydroxide through the apex. They look fantastic. Anyway, they went in the bin. Loops. Oh, I think I had them for about the last 8 years of my working life. They're a lot better with loops, surprisingly, especially with the light. And you see a lot more. And, I remember thinking, just because I'm seeing a lot more, it's really useful when you're trying to find a canal. But it's sometimes when you're looking at a lesion thinking, that wasn't there before. And then you think, well, actually, maybe it was there before. I just didn't see it. So should I do anything about it if I couldn't see it then? Dentistry is a bit of an art in a way. Well, a lot of a way. And this one, wave one. So I had, when I finished, I had reduction handpieces for a long time. I'm a bloke, I like gadgets, and some of them worked. This one, I think, was excellent, but I didn't use it. And I'm pretty sure that you only need one file. So what we forget is the reason it progressed is because of CJD, and we were getting paid less for root fillings than the actual equipment, never mind the time. Now, if you just use one file, clearly, that's a little bit cheaper than the amount you get paid for root filling on the health service. But let's be fair, it's nothing near the amount of time that we need. But the good thing about this one is, I think it's on the next slide that I just added. Oh, it's about, yes, apex locators. I use them. So back in the day, the apex locator was just a little hook, a little bit like they have the parachute hook there. And yeah, so they were tricky enough to work. And they worked reasonably well. And I think they were better than radiographs in a lot of ways. But of course, now the latest micromotors, and they often have an apex locator within them. So that's a double whammy. I'm not quite sure how much they cost, but I don't work anymore, so I don't really care. But I think apex locators are very good, especially when you look on, even on some basic standard radiographs or X-rays, whatever, because the teeth aren't always straight. They might have a wicked bend in them. Anyway, using the wave one, as I say, I think I used it once, but there's a video on it I've only just found. I was looking for it for wave one. Did it have an apex locator? And I come across this video. And of course, then they have actually got some videos on with leads. If you're from a university that has them on such things as how to do class 1 amalgam, won't be a class 1 amalgam, don't do them anymore. Class 1 filling, not even sure if they're called class 1 fillings anymore. Anyway, any treatment, let me know, and I'll put them on a website I made called Denflix. Anyway, so this is a resource, and I think, where is it? It's got a reason. I haven't fully looked at the resource for endodontics, but yeah, well, it's got 6 videos. Give them a look. So this is the ideal way to teach. It's with a bit of humor, and I remember this watching it with the children when it came out. I think it's about a minute long. This will be the best bit of the whole thing. But listen out, it's so good, they repeat it. And one bit, even I don't understand. It was made by an endo guy.
Those X-rays, it's not going to be pretty. Yep. What did he use to open? Gator Glidden Drill. He seems to be favoring that one lately. Okay, I'll do that. Now he's doing the shoulder tip. It's using a headstroke file. That's not a headstroke file. That's a K-flex. It's got a teardrop cross section. Clearly a headstroke. No, K-flex.
I don't play them.
All right, go ahead and read it. Oh, the human mouth is a disgusting place. Hey, Nigel. What did I miss? Am I late? Root canal, and it's a doozy. Root canal? Huh? What did he use to open? Gator Clinton Pro. He's been favoring that one. Hope he doesn't get served with cereal on the second and fourth terms. Hello.
Right. So I just realized he missed a bit. Yeah. He didn't have a rubber dam on. He said he had rubber dam on. He didn't have rubber dam. They're really tricky to draw. And the other thing was Gates Glidden. He mentioned them twice. I always really liked the Gates Glidden. It's a little bit like Lightspeed. All you want to do is you need it to open up the access for the file, and then you just had to roughly dangle it in the right direction, and then it would pick up the canal. Off you go. The other thing was hypochlorite. Now they say you want say you needed the rubber dam for the hypochlorite. Well, it isn't. We had it initially because of the worry about dropping the files. So the hypochlorite, it's a bit of a long story, but basically I remember asking a guy in Perio, the Perio professor, we had a discussion, and I said, well, what's a safe amount for using hypochlorite in the mouth? And he said, well, we don't know. No one's ever done the research because hypochlorite's so cheap. And there was no research, and I don't think they had a Cochrane library. And so off I went. Hey, we didn't have the internet. So, but now they do. Now, I did the maths a while ago, and I worked it out. So the amount that you actually need of hypochlorite within a root canal system is tiny. Right. So, and how much do you need? Well, you just need enough hypochlorite that's actually in the canal. That's what's doing the work, not the bit that's sitting outside the access cavity, not the big lump that's, sort of swilling around in your rubber dam. That's doing nothing. It's just creating mayhem. So you only need a tiny amount. And I know I've got another slide coming up because this is my second attempt. First one went belly up, as will this. But then what I used to do, I was always a bit concerned when I used the hypochlorite that it has got a really long half-life. So if it's an irritant, surprisingly enough it is, then you don't want it there for too long. So I used to rinse it out with Sterilux. So we got Sterilux again. Oh, that was the Legionnaires issue. So we had the issue about Legionnaires. Dodgy research on that, but there we go. So yeah, I used the Sterilux, and that was great. Well, when I say it's great, you could squirt that with, I think you can actually drink Sterilux. When the guy showed you how to use it, he brought it around and he had a little drink showing how safe it was. So it was a lot better than hypochlorite swishing around. So yes, I'm not sure that we need rubber dam in this day and age, and it certainly saves time. And if the patient, is totally uncontrollable, then fair enough. But everyone can keep the access cavity dry. So this is, again, slightly different. I come across this material. I went to Cardiff on a course on this, and I'm not sure if they still do it in the UK, but it was a sealant with a radio opaque white material that you put in. I wish I knew what the material was. Can't remember, but it was hydrophilic, the paste. And so you spun the paste. Well, did I spin the paste? Anyway, you put the paste down. And the paste, and then you then put the point in, the preformed point, and that the paste would then go up the lateral canals, which is what you want. You want to seal as much of the tooth as possible. So we'll probably come on to the lateral canals. But this was a really good smart seal, and there are other similar ones available, but that's the one that I used until I sold to a corporate. Yeah, and had very few post-op things. It was one of those things, as speaking to other people that used it, they found it really good. But often you find out that when we use something and we want it to work, we're a bit biased. But this was an interesting one, is that do you want to do one visit or two visits? A while back, I can never remember when, but the Americans on a molar would do one canal at a time. I think, geez, there are so many things that are wrong with that, right? So yeah, so many things that are wrong with that. So I used to do it in the end in just one visit. So years ago, I used to always do it in two visits, and then went on a course, and some people said, well, you can do it in one visit really, and you have to think logically, which is difficult for me. But basically, if you can get the canal dry when you're doing it, and you're pretty sure you got to the working length, then active infection or whatever doesn't see, or whatever it is, isn't active. So as long as you can keep it dry with your paper point, I'd seal it. So I do it in one visit. Yeah, and this is Cochrane. So if you go to Cochrane, hardly anything works, or it always says this requires investigation. This is a thing, a system that looks at 2 million research papers every year, and nearly all of the reviews say this requires greater detail. And so these are some of the things that it said. So the one thing it does say, with a single visit, you tended to get, they think, slightly a bit more discomfort or pain. Well, when I used to do them initially when we started, it was sort of, most of them had a bit of discomfort afterwards. And if they did, then they come back and they expected some antibiotics, and we would give them. And then the vast majority would settle down. And if they didn't settle down, they would come back and, sometimes you had to take the tooth out. But that hasn't happened. I can't remember the last time I took out a root fill tooth, and it's not just because my memory's bad. Anyway, as I said, look up your own references. And this is the explanation that I've heard, and I'm not sure when I heard it, but it's a great explanation. And I obviously stuck the slide of apex located to remind me to mention it. I think they're very good. Anyway, but digital x-rays, they're also really good. It measures the GP more or less. There's no playing around. You pretty much, where you are. So I think I made a picture. And the thing about the crystals is the best endodontist I knew was so confident about them. When he'd finished them, he'd advise people buy some crystals and sit around them, or he had something to do with the crystals. But yeah, when you finish some treatment, you just have to cross your fingers. And what's the other thing? A little rabbit or something, a fluffy rabbit, anything, touch wood, wherever. Anyway, I make these videos. And so this one is kind of back to front in a way, but hopefully it's starting to look a little bit like a tooth. And diagrammatically, they're always a little bit better. And I think for the general public, they prefer diagrams. This is obviously a bit of a stretch to call this a diagram, but I did paint this or draw it or something. And so you should recognize that all the lymphatic tissue and the nervous tissue and all the blood vessels within this vital tooth, but unfortunately some decays happened. So, and then it's just got infected, as you can see there, you can show it on the radiograph. And so what we have to do is, well, we've got to get rid of all that gunk in the middle of the tooth. So we clean it out with our hypochlorite, and that's great. Once we've got rid of it, we're going to seal it now, and then hopefully it will all heal up. And I can't remember the time. Oh, there we are. It's healed up. And then I may even replace the filling at some stage. Yeah, be brilliant. I'm not going to crown that one. Anyway, I normally waited and give it 6 months to make sure that, it's bad enough if it went wrong. Anyway, this was the idea, is that this is what the actual tooth is like. So we never clean out 100% of the pulpal tissue. At best, you probably get 80%. You've got all these other little bits sticking around everywhere. And so, we're reliant on a lot of other things. And possibly, you won't will it away with your mindfulness. But if your immunity is a little bit better, and generally you've got a high pain threshold, then that always helps. And yeah, as I said, I give antibiotics if they played it, but I think that was the mistake. I should have just been given analgesics. Anyway, so that's the thing. If you just think you are not cleaning it all out, despite what anyone tells you. I think obviously the narrow tubules fill in dependent on your age. They fill into the point that you can't find the canal, then you want to give up. Oh yeah, so with your immunity in perio recently, that's something that's changed in my lifetime, in that all we know that the best thing that works is, well, cleaning your teeth or cleaning your gums. So we should be telling people to clean the gums twice a day, and the teeth will look after themselves type thing. But if you get to 18 and you haven't had a filling, yeah, we should be just saying clean your gums. Yeah, so what they've found is, or someone's found, I couldn't find it on Cochrane to be honest, but these 3 very cheap bits of medication help with your immunity. So a mini aspirin, statin, take statin, cod liver oil, take that too. Omega-3 or omega-4, not quite sure. I don't take the mini aspirin, probably should. I take the other stuff for, oh yeah. Oh, anyway, you take the other stuff because I'm often here in a pub. That's not strictly true, but I was in a pub with my manager many years ago when we started using the hypochlorite, and I was explaining the problem that we were getting post-operative pain with some people, and you got a few, you know, so you heard about it, but you're thinking, what's going on? And people were squirting hypochlorite through open apices and some that weren't that open. And as he was saying, this chap was doing a PhD in physics in Bristol University, and to state the obvious, any fluid follows the path of least resistance. So you want to be careful that when you apply the hypochlorite down the canal, you don't want it to jam basically the needle down there. You want it to be able to flow back, because that's what it'll do. You'll only ever push it through an apex if you jam the needle. And so that's what you need to be aware of. So the way I used to do it was obviously put it over the canal, down the canal to a point, make sure I applied it, you know, added but a tiny amount. You know, the amount in a syringe, if you I always used to say to my nurse, just fill up about a third of it because I don't need much. I just need enough to be in the canal. And so as soon as I saw it coming through to the pulp chamber, I would stop, because then you're going to displace it with your file, and it's the file that'll carry it to the apex if you're lucky. So then you take the file out, dry it, put a bit more hypochlorite in, do it again, repeat, and then after that, yeah, Sterilux. After that, dry and fill. So that's how I used to do it in the end, and we had very few failures. Saved a fortune and rubber, and the only thing was that I also had an ozone, and I think I sort of drift off here. But the ozone you could use for root canal, but I never did because the kit that came with it, I couldn't quite work out how to use it. It looks slightly dangerous, but I found these. Well, clearly that's why we use rubber dam. And as I said, that's someone who's been using it as a hand file. It's not clipped in. They haven't got the, it's quite a bit difficult to swallow a endodontic handpiece with the file attached, particularly if it's got a cable with it, you know. Anyway, but it's not so difficult to spin off. So I'm sure some of you have been trying to put this on. In the end, there's a little hole in the clamp, isn't there, to add a bit of floss just in case you spin it out. But clearly you can't see the floss there, so they forgot. But this is where things get terrible. Is this one, as you can see, yeah, it's in a child. So I got these on Pinterest. No one likes to show off their expertise and loosen these things. But this was on Pinterest, and I knew there were cases of people swallowing clamps, and you can imagine it's difficult. But a 4-year-old child, why are you putting a clamp on that? If you go on YouTube, there's one of someone doing endo on 4 deciduous incisors to fit post crowns. You know, that could have been fatal. And there's another one of a person doing ozone. And yeah, the ozone doesn't go anywhere near the mouth. It sort of jiggles around by the chin. And you're thinking, what, you know, who on earth thinks that's going to work? But actually, if you say it, you'll have a bit of discomfort for this for 3 or 4 days. Better take these antibiotics as well. Then it works. You know, I'll go down that route. I never did that. And so that's my ozone machine. And I'll talk about ozone somewhere else because it's a bit of a long story. But the Diagonodent that I use with it, that was really very good. And as you can see here, they still use ozone for endodontics. So I'm not going to start reading this because I've retired. But I do think, as is the case, ozone is more permeable than hypochlorite. So it potentially is better, and it can be applied safely. And if you spent a small fortune in this unit, then it'll definitely work. It works for coleslaws. What's another thing? Yeah. And what's this one? Oh, yeah. So the other thing that we had, when was it? The problem was the reason that we ended up with these night-eye files is partly because of a problem that we had, and this is where you have to think, is it was BSC and the potential for prions to come from the pulpal tissue. I don't know if it's ever been proved. A bit like HIV when we all got sterilizers, you know. Anyway, so I'm sure someone lobbied the government to say, if you use a dishwasher, that'll clean your materials. Clean it so that it'll remove all the product. Well, you only have to look at your dishwasher at home. How's it going to get some of the debris off the equipment? You can only ever get it off by cleaning by hand with a good scrubber, really. So you've got to wear your gloves for that. Anyway, we all end up with dishwashers, but that wouldn't get rid of a prion, right? And we knew that. But what would get rid of a prion was, as one of my patients said, was ozone. And at this time, Dyson was developing a washing machine using ozone. I think it was a bit sad. I think I contacted them. But I did look it up, and to see, as advised, it was a sterilizer that used ozone as well. And there was, and it was this company in Canada. And I went on the website. And the reason I remember all this is I was #1 on the website. And the company was called Tristel. I'm not sure if it's there, but I'm pretty sure it's called Tristel. And anyway, it's kind of gone away now. I think the 10-year period has passed. Yeah, so that's a repeat. And then these are just some examples. So I don't think I did the root filling for this patient, and I didn't do the crowns either, but I may have done. I haven't got the files, and I don't remember doing them, but I do remember this little lump, and this little lump used to bother me because if she'd only had one root filling, you know, he'd have taken that tooth out with the root filling, because to be honest, they both look a little bit suspect, well, extremely suspect. So I sent to the dental hospital and said, what should I do? I was hoping they'd say, we'll do an apicectomy. Generally, I think apicectomies work because people think I'm not going to have that again. It's fine. So the dental hospital said, I think they said, take out the 6. I said to the patient, is it bothering you? She said, no. I said, well, we'll keep an eye on it. And clearly, by this time, I've got clinical photos, which I just used to show the patients. So I have to say they're pretty rubbish. The radiographs aren't so bad because I needed to know what they're on them. But you do it quick. These cameras are great. You can just quickly flick them in and show someone. They're worth the weight in gold. As of the radiographs, you should show your patients them and explain. And I used to put bite wings, you know, previous bite wings and current bite wings up to show if there'd been any change, which is what prevention's all about. So yeah, we did nothing. And this is 10 years later. It went. Still got the tooth there. And of course, you know, some of you may have said, right, well, we'll take both teeth out and we'll do an implant, and we'll have an implant retained bridge, or we don't know how long these things are going to last. All I do know is this has been fine for her, and it probably lasts a hell of a long time. The likelihood is she won't need a bridge because on balance, I think it's the 6 that's the problem. So this is a different thing. I used to do peer review, and it was just, we talk about different things, and this is from a kind of presentations, putting it a bit strong. So again, you can just read it if you want. But as you can see, this particular patient didn't have a lot of tooth tissue left. And to try and do a root filling in the lateral, you know, there are some that are just not worth trying. And so I didn't do one. I just put a crown on. I don't think it shows it. Yeah, I think I put that up there just to show that some canals get obliterated. But I did put a crown on there, and it lasted long enough because she was in a very elderly lady, and yeah, so that's a different thing altogether. So this one I didn't do either. It was a patient who came in, a new patient. He had this work done 20 years ago. So there are 2 things there. One, from memory, whilst it doesn't look like it, I think he's had the 5 and the 6 had gone. Yeah, and that's the 7 in his wisdom teeth. And yeah, the root filling isn't great. And it only lasted 20 years. So I'm just saying things last. This particular one, I know I did this for a patient of mine. I used Lightspeed then, and I did it a long, long time ago. And the reason I remember it was a particular patient who, you know, she didn't want to lose the tooth. And she was a nurse, and I said, this is never going to work. because the area was up 50% of the tooth. It was a very large area on the 5. And I used the light speed on her. Looks like I used thermofill on her. I'm pretty sure I did the crown afterwards. I don't remember seeing, I don't know, actually. I may have done it after. I never kept replacing teeth with crowns, especially if I did a root filling. I'd wait to make sure the thing lasted before I crown them. Anyway, this one I may have done the root filling through the crown. And the 6, I probably did that. You know, when you had silver points, a lot of the time, if you like up to a size 15, you can't get GP down. And well, you couldn't back then. So that's why I stuck a silver point just to show I'd found the canal. Anyway, what I'm saying is it worked for her. And then what happened, a sequence of events is, yeah, she had decay under the lower 6 and something broke. So I did my normal thing of putting in a massive glass ionomer because I didn't like putting in massive composites from the previous history it had with them. And you can see these things there. That crown doesn't fit that well. And it's held in a bit of a pin. And I did a CEREC on the 6, trying to close up the space closure and left the other an open, open contact. So there are lots of things you can learn from radiographs in the history. And so I made a crown for her, and she started to get some discomfort after I fitted the crown. And all I ever did for crowns in the end was, if I'd done glass ionomer, I'd remove the glass ionomer at the end with ultrasonic and just remove any real imperfections and take a scan. I didn't really do a crown prep in the end. And often with teeth like this, there was nothing left there was nothing much to hold it in. But anyway, we got her away with a crown. But then, yeah, she ended up with an infection. As you can see, another massive infection, a tiny little canal on the mesial roots, whatever. So because the other one worked, I thought I'll give it a go. And so you can see there's no sign of a rubber dam clamp, I'm sorry. But you can also see there's a sign that I nearly perforated looking for the canal, which, you know, that happens quite a lot. It's in everybody's hands. But anyway, I was lucky I found the canal. I probably found 3. And you can see, you know, the previous root canal that had failed. There's the remnant there. But yeah, so that's what I did, and it healed up. Did it through the crown. I never replaced the crown, and it was fine. And so that's what I'm saying. Some people seem to, nothing works, and some people, things do work. And this was, again, the perio is a nonsense. I had a bad referral to a perio person, spoke at length about that. I think I'll do a separate one on perio. But this was a referral, and I didn't refer much. And this is one of the reasons, is one, to be frank, most of my patients, and you had trouble affording me, never mind referring to a specialist. But this person, and this is terrible when you think, oh, well, I know she can afford it. And I know, she, you know, as we all are, she's very keen to hang on to her teeth. Well, I say we all are, not all of us, but she was. And this just looked to me like being a difficult root filling, or I started it and it wasn't working out. So I referred her to the endodontist, and he did a great job on the 6, which I asked him to. And when he was there, he decided that the root filling I'd done on the 5 wasn't good enough. It may have been about a millimeter short or something. So he thought he'd do me and her a favor by redoing it. And he did. And it was fine for a while. And then she started getting pain. And, you know, the root fillings in the 5 and the 6 looked fine. And so I could never work it out. And it was massive filling in the 4. And so, all right, I'll do the 4. Anyway, I did. And I remember it was vital. Both canals were vital. And that I always found that depressing. I was much happier when you could tell that the tooth was infected. And yes, I often waited for some apical area. That was, in the end, that was my main criteria. However, as you can see, it wasn't the 4 at all. It was the 5. And we know why. It'd been over-engineered, as you would say. And the root had split. So, yeah, there's not much you can do there. The sad part was I referred her to an implantologist who's really excellent. He lectures on implants. And what is weird is that I wouldn't say trained, but I mentored him, I suppose. Well, anyway, we had lots of chats about teeth. as an FD, and he got a CBCT scanner, and when I referred to see him, he had a look at the 4, and he said it had 3 roots. So we could try and do the 3rd, or rather he could try and do it. Well, you got to be mad, and there's hardly anything of the tooth left on this particular case. So the only option was to take it out to be 100% sure. And yeah, so it had an implant placed and a bridge fitted. And that's a shame. But on reflection, if the endodontist hadn't touched the 5, she would have saved a fortune in pain, time, and money. And I never did this root filling. It didn't look great, and really there was nothing. You couldn't crown the tooth anyway. There's hardly any of the tooth left, although I did try. Anyway, it's opposing a bridge, and I never took this tooth out when I left, which was 2000 was it? I'm losing track, but anyway, so you can see it lasted a fair old while. I think when I had Moseric, I like put up a post in the mesial aspect of the tooth, and then just took away some of the occlusion, and in the end it just wouldn't stay in, and it's one of the few that I couldn't get to stay in. But we were both reluctant to remove the tooth. Who knows, it probably over erupted, but you're still getting function out of it. And the only thing that I would say there is it's self-cleaning, so probably, as you would say, see him out. Yeah, and he wouldn't have worn a lower partial. And that's the video that I made for the public. As I said, it's on YouTube. I don't know, it might play. No, it won't play. I'm in my shed. So the internet access is really poor. Oh, right. Okay. I hope you found that useful. Please get back to me. Clearly, I've got the slides. I can redo this. I probably have to redo it because I've probably done it wrong. But anyway, hope you found it useful. Any questions, get in touch. That's it.